Hi, I'm Dr. David Dobson. Welcome to Conversations. Today, my guest is Dr. Deidre Popovich. Deidre is the co-director of Healthcare Lab, a research group focused on understanding consumer decision-making in healthcare, and an associate professor of marketing in the Rawls College of Business at Texas Tech University. She earned her PhD in marketing from Emory University. We will discuss her research in healthcare marketing. It's a great pleasure to have you with me today, Deidre.
Well, thank you so much for having me. I'm thrilled to be here.
What is healthcare marketing?
That's a great question. Healthcare marketing is very similar to marketing for other products and services. It creates engagement with consumers and tries to portray the value of healthcare services. So healthcare marketing assumes that consumers are actively shopping and engaged with the healthcare system, and they're looking for different ways to get care. And in fact, healthcare is becoming increasingly consumerized, especially in America, but really all over the world. And I should also preface that I'm going to talk about this from a very American perspective because I'm in the US. But recently, legislation in the US has been passed to make hospital prices more transparent for consumers.
Okay.
So this assumes that people can shop and compare providers on cost and quality metrics when they're able to. And of course, we have new offerings in the healthcare space like Amazon Health and Walmart Health. And all of these assume that consumers are looking for more affordable care and more convenient care. So healthcare is really a complex service, but it's marketed very similar to other services.
What brought your research interest to healthcare marketing?
Before I became an academic, I worked in various roles in industry, and one of those jobs was as a strategy consultant for a top 10 healthcare consulting firm. So I've kind of always been interested in healthcare. Since my PhD program, I've become more and more interested in how consumers make decisions, and especially situations where we give consumers more information, but this doesn't necessarily help them make more optimal or better decisions. So healthcare is one of those very unique decision contexts where giving people more information may not always be helpful. So much decision making in healthcare is very personal, and these decisions can be very complicated sometimes.
Your research approach to healthcare is from consumer psychology perspective. Can you explain this approach?
Consumer psychology is really the study of how people make decisions about consuming products and services. So we examine how people's thoughts and their feelings and their beliefs and their perceptions influence relationships with goods and services that are being marketed to them. Consumer psychology also considers how people respond to these marketing efforts and other external stimuli in the environment that might shape our purchasing decisions. So we're studying how the marketplace can shape our attitudes and choices and ultimately our decisions as consumers. Marketing lens has a lot to offer when it comes to understanding health choices because it's such a unique service context. So
especially from a consumer psychology perspective. So why it is important to understand consumer decision making in healthcare?
well, healthcare, as I think I mentioned, is getting more expensive in the US. It's getting more difficult for people to get care, and consumers are required to make more decisions about health than ever before. So understanding how people make these decisions can be really important for healthcare organizations, for providers, for policymakers. And I think healthcare organizations want to provide interventions that increase consumer perceptions of value. So this is a good value for my money. I'm getting the care that I need. But understanding how people make these purchasing decisions can help design different interventions. So things like price transparency, providing more prices to consumers. How should we portray that price? How should we display the price? What should we compare it to? And all of those things can help providers kind of tailor their services and meet the needs of consumers.
You are also the co-director of Healthcare Lab. Can you share some of the research your lab is involved in?
Sure. The Healthcare Lab is a research group focused on understanding consumer decision-making in healthcare. And I run this lab along with Professor Kelly Frias, who's at American University in Washington, D.C. And right now we're mostly studying consumer perceptions about healthcare access and affordability. people in America are pretty divided on how policymakers should approach healthcare, for instance, and
Okay.
most people agree that it's too expensive, but what is the best approach to curb those costs? So shopping for healthcare is not like shopping for shoes. We always say we're like shopping for another thing that we usually are used to shopping for. So there are a lot of constraints, stress, making a good choice for yourself and your family members.
Yeah.
So we're really interested in those issues in particular.
Yeah. In US, healthcare is privatized, and I believe the consumer has a lot of option, but still the healthcare is super expensive, very, very expensive. Based on anecdotal, people buy their drug from Canada because in Canada we have public healthcare and drugs are relatively cheaper.
Yeah, and we've studied consumers in our lab who live on the Texas-Mexico border, so similar situation to traveling to Canada to get cheaper care or cheaper pharmaceuticals. And those people aren't just engaged in medical tourism. They're not just going to get, plastic surgery or something like that. It's really out of necessity that they cross the border to get cheaper and quicker care in Mexico.
Yeah. What are some of the challenges the healthcare industry faces today?
Affordability, as you mentioned, is a big concern. And sometimes people will put off getting care due to cost concerns, which might ultimately make healthcare more expensive overall. So it's not a good situation to put off getting care when you're worried about the price, because ultimately that can make all of the care more expensive. There's also a lot of new technologies in healthcare these days, like telehealth, but also things like AI and chatbots are coming into the space to help fill in the gaps when providers aren't available to consumers. So we need to do more research to figure out how receptive people are going to be to these things, and whether they might be helpful or actually end up perpetuating inequalities, for instance, in healthcare. So I think physicians are under a lot of pressure to see as many patients as possible, but it's difficult for them to form the relationships that they need to form with people to ensure real high quality care.
Based on your research, what is your advice to consumer when seeking healthcare?
I think one piece of advice that I have for consumers is to shop around as much as they can. Again, you don't think of healthcare as a place where you can shop, but there's a lot of times when you can plan things in advance, like procedures and tests that you can get. And if that's the case, then sometimes insurance providers will provide incentives for people, like rebates if they find a lower cost provider. So if you need something like an MRI, you can look at different places and see if there's a cheaper option available. Another thing is, I think, to be very proactive in this space as a consumer, and know what you need and advocate for the care that you need, because physicians are busy and they have a lot of patients to treat. So we have to be our own best advocates, and we know our own bodies best, I think.
So if people do some research for their healthcare, what are some of the places they can begin with, like before they go out and seeking treatment, for example?
Well, in the US, they can check with their insurance provider first, because sometimes they have decision tools available on their websites for people to compare different places to get care. What are the costs? What are the quality ratings of those places? There's also new entrants in the US that are just about comparing the prices across multiple places to get care. And so you can you can Google a lot of things. Not that I'm advocating to Google for your symptoms, but you can Google prices and things like that.
Okay. Based on your research, what is your advice to healthcare providers and policymakers in healthcare delivery?
On-demand, convenient care is becoming more common. So consumers are craving these convenient, affordable options. And I think these are going to be received very favorably. Any offerings that are less expensive and more accessible to people will be helpful. But these offerings will also have to provide, high quality, trustworthy service so that people will be loyal and keep coming back. And obviously that's true of any service, as you know, but I think especially in healthcare, that's a really important consideration. Consumers also want to feel included in their healthcare decision making. They want to feel seen. They want to fit into a space.
Yeah.
And they don't want to be confused by branding or different types of branding. If a hospital system owns this hospital and they have different names and it's confusing for people, that can happen frequently. So trust and belonging and creating good branding, good messaging, and thinking about marketing as a healthcare provider is really important, I think.
What is your advice to researchers who want to do research in healthcare, in marketing, for example? Something similar to your work.
Yeah, I think marketing scholars in particular should be involved in researching healthcare. We think about public health and we think about on the medical side, people looking at medical decision making, but we study decision making and we study marketing interventions, and all of those are so important in the healthcare space. So I would encourage marketing scholars to get more involved in studying healthcare, but also it's a field that scholars from any discipline, I think, can get involved in and learn different types of insight.
Thank you for your time, Deidre. Have a great rest of your day.
Thank you so much. I appreciate it.